Let's check in with infectious disease specialist Dr. Zain Chagla, who's with us this morning with all things health related. And things have actually changed, Dr. Chagla, because normally it was all things COVID related. Now we're on to other things like monkeypox.
Yes, it's never a dull moment, I know.
Would that be, well, that's even my first question. Because what we've been through for the past 2+ years with the pandemic, would monkeypox be a thing?
Yeah, look, I think
in the public consciousness is what I'm talking about. I know it's a thing.
Yeah, I agreed. I think we're all hypersensitive. But the reality of the situation is we are so globally connected. The fact the population has grown, that we're invading into areas where reservoirs of disease like animal vectors are around us. These spillover events are going to continue happening. They've been happening over the last 10 years, but they've been happening in more frequency since then. And so we have to be prepared for any pandemic from happening, and we have to be prepared for disease that we thought was, relegated to one part of the world, all of a sudden showing up in another part of the world. And I think that's just crosstalk. It's, discussion, it's planning, it's pandemics. And there's a lot of work being done in the background to make sure that we can respond appropriately to these things rather than panic when the time comes.
I know you talked about monkeypox a lot to Annette last week, so we don't need to get into all the details, but if somebody did miss that, key points being what?
Yeah, so this is the largest cases of monkeypox outside of sub-Saharan Africa that have been seen. The disease presents typically as a rash, kind of bumps that turn into pustules that then burst open. Right now, the vast majority of cases are gay or bi men who have sex with men, although there are cases being seen in populations outside of that. And so if people present with a rash, with swollen lymph nodes, with fevers, and have a concern, let your practitioner know. There is testing available locally and nationally. But people do need to be on surveillance for this, as it is spreading. Cases are increasing. There's a couple of cases now in Toronto that are confirmed. And so we really do need to make sure that people are taken care of. That being said, this is a disease with case and contact management, and even with vaccination, with the smallpox vaccine, that we can stop transmission when cases are identified.
Because it's the same family as smallpox, which has been eradicated.
Exactly. And one of the theories of why this is coming back now versus 10, 20 years ago is that our population that got smallpox vaccine is now over the age of 50. And so there's this nice reservoir of people under the age of 50 that have no immunity to this virus, as they weren't vaccinated against smallpox as well. And so, this may be something that comes intermittently. Even if this cluster is controlled, there's huge cases ongoing in Nigeria and the Democratic Republic of Congo. We may see monkeypox from time to time in Canada. And again, we have to be prepared to deal with it.
And we're all more interested in it because, I don't know, we're all kind of, we think we're all infectious disease specialists now, but we're not. That's why we have you on the show. Great to see you. I think we're in a good spot as far as COVID goes. Obviously, we're being safe, wearing our masks, but as far as hospitalizations go?
Yeah. No, pressures are down. People just, again, need to respect the public health rules, but we're in a good spot. And again, as long as people are getting vaccinated, and getting tested if they're considered at risk, and then accessing treatment at risk, we're in a much better spot than we were 2 years ago.
And we still get to talk to you too. Great to see you, Dr. Zain Chagla, for his weekly visit here on Friday on Morning Live.